I'm Greg Stuart. This is what I study.
It means that you've been out every night this week.
Are you my warden?
No.
The talking about. I deal with enough. I don't want to have to deal with you. What are you looking at? Go to school. Go to school.
My talk will focus on physical violence, defined as anything from a push or slap through beating up, choking, or using weapons against a partner. Couples do many nasty things to each other, including emotional abuse and sexual coercion. Our research addresses all of these forms of violence, but I'll talk mostly about physical violence because 20 seconds passes by very quickly. How much violence is out there? It depends on who you ask and how much you ask and how you ask, but it happens a lot. In national surveys, 25% of couples endorse past year violence. On campus at UT, 30% of college dating couples endorsed violence in the past year, and 37% of males perpetrated sexual coercion. Women do it too. The prevalence of physical violence is similar between men and women in national samples, newlyweds, couples seeking therapy, and dating couples at UT. The majority of studies show that women are slightly more likely than men to initiate violence, and violence is often bidirectional in as many as 85% of cases. Male-perpetrated violence has more detrimental effects than female-perpetrated violence. Female victims have more physical injuries, more symptoms of depression, and are more likely to require medical attention than male victims. But violence is bad simply because violence begets more violence regardless as to who initiates it or perpetrates it. Of course, the consequences of partner violence are bad for everyone. Negative consequences include depression, suicide, hopelessness, post-traumatic stress disorder, substance abuse, and spousal homicide, to name a few. And intimate partner violence is also associated with child abuse and other negative effects on children. There's a lot of data that link alcohol use and violence. For example, 75% of men and 67% of women in alcohol treatment report perpetrating violence in the past year. And 2/3 of men and over half of the women in domestic violence treatment programs have current alcohol problems. This slide highlights one theory explaining the relationship between both partners drinking and violence. And as you can see, the relationship is complicated. This slide is hard enough to understand when you're sober, so I'm not even going to try to explain it to you now. Ask me about it later after you've had a few cups of strong coffee if you're still interested. We examined the probability of physical violence perpetration on a drinking day in men who've been arrested for domestic violence and court-referred to batterer intervention programs. We found that men were approximately 2 times more likely to be physically violent against their relationship partners on days they drank alcohol compared to days that they did not drink alcohol. In women arrested for domestic violence, women were about 10 times more likely to perpetrate violence on days that they drank heavily compared to non-drinking days. And the women were about 6 times more likely to be victims of violence on days that they drank heavily compared to non-drinking days. We've talked about the prevalence of violence, the link between drinking and violence, so now let's turn to what happens to violence over time. Violence persists in the absence of treatment in 75% of cases, followed for 2 years. So if we do nothing, violence is likely to continue. And the more frequent and severe the violence, the greater the likelihood that it will persist. So what if we do treat violence? When a person is arrested for domestic violence, every state in the U.S. typically refers the person to batterer intervention programs in lieu of jail or other sanctions. The problem? Some studies show that batterer intervention programs have only a small effect on violence. Many others show no effect at all. And batterer intervention programs are complicated by substance abuse. Substance abusers may not benefit from violence intervention because they may not learn and practice the skills that are taught in treatment. The majority of violent offenders are substance abusers, and heavy drinkers are 16 times more likely to have violence recidivism than infrequent drinkers. We've conducted several longitudinal studies of violence in treatment-seeking alcoholics. Our studies show that the prevalence and frequency of violence in both partners decrease after one partner obtains treatment for alcohol use. Not surprisingly, the prevalence and frequency of violence is higher in relapsed alcoholics compared to remitted alcoholics. So violence decreases after alcohol treatment. Batterer intervention programs have a minimal impact on violence. The majority of batterers are substance abusers, so given the association between alcohol and violence, why not add an alcohol treatment to batterer intervention programs? We conducted a randomized clinical trial in which men arrested for domestic violence were assigned to either the standard batterer intervention program alone or the standard batterer program plus a brief alcohol treatment with my staff. The alcohol treatment was only 90 minutes, and the goal was to improve both substance use and violence recidivism outcomes. We found that compared to men in standard batterer intervention alone, men receiving the brief alcohol treatment had better drinking outcomes and better violence outcomes for 6 months following the treatment. Regrettably, by 1-year follow-up, there were no significant differences between groups. We're in the process now of conducting a similar randomized clinical trial in women who've been arrested for domestic violence. We're also trying to identify genetic predictors of who responds favorably to violence and alcohol treatment. One of my long-term goals is to improve violence treatments and ultimately facilitate patient treatment matching based on genetic characteristics. We're conducting a longitudinal study of dating couples at UT to examine risk and protective factors for violence. We're videotaping relationship problem discussions, and we're collecting DNA from both partners. And we're particularly interested in understanding whether the interaction of certain genotypes between partners confers increased risk for dating violence. Our current work involves longitudinal studies and treatment outcome studies of violence in high school students, adolescents and pediatric emergency departments, college students, and child and elder abuse. My career goal is to increase understanding of family violence across the lifespan and to use this information to inform, develop, and test a wide variety of interventions. Thank you very much.